Good morning, everybody. Imagine being sick and in pain every single day, feeling like you have no control of your life. Now imagine having the choice to die with dignity. That's what assisted suicide is about, and today we're going to talk about that. It's a big issue because it's the choice on whether people should have to end their lives if they're very sick or not. Assisted suicide, also known as physician-assisted dying or euthanasia, is a highly debated, serious, and sensitive topic. Supporters argue that it offers terminally ill individuals the choice to end their lives suffering or die with dignity, while opponents raise the concerns of potential abuse or ethical implications. I care about this topic a lot because I think people should have the right to make their own choices about their own lives, especially when they're very sick. So today I'm going to talk about 3 things: why I think people should consider assisted suicide, why it's illegal in some places, and why it's important to be kind to anybody who is sick. Every individual should have the right to make decisions about their own life and death. Allowing assisted suicide empowers individuals facing unbearable suffering to have control over their end-of-life care. For terminally ill patients experiencing severe pain and loss of quality of life, the option of assisted suicide can provide a compassionate and humane way to end their suffering. Studies show that allowing assisted suicide respects the individual's autonomy and dignity by honoring their wishes and providing a peaceful and dignified way to pass away. So now I will discuss why people believe assisted suicide should be illegal. Some individuals hold the belief that all human life is inherently valuable and should be protected, regardless of the circumstances. They argue that the intentionally ending a life, even at the request of the individual, goes against the fundamental principle. There are ethical concerns surrounding the practice of assisted suicide, particularly related to the potential of abuse, coercion, and manipulation. Opponents worry about legalizing assisted suicide could put vulnerable individuals, such as those with disabilities or mental health challenges, at risk, being pressured into ending their lives. Some people argue that the role of healthcare providers should focus on providing palliative care, pain management, and emotional support to terminally ill patients, rather than being involved in actions that directly result in death. Studies show from Penn Medicine that 0.3 to 4.6% of deaths result in euthanasia, with more than 70% involving cancer patients. Furthermore, religious beliefs and cultural values often influence people's perspectives on end-of-life decisions. Many religions consider assisted suicide morally wrong and the view of life sacred, which informs individuals' opposition to legalizing practices that deliberately end life. Overall, the opposition to assisted suicide stems from the various moral, ethical, and practical considerations regarding the sanctity of life, the role of healthcare providers, potential risk of abuse, and the availability of alternative care options. Lastly, I will discuss why we should always be kind to people who are sick. Being kind to people who are sick contemplating assisted suicide is important for several reasons. Showing kindness and compassion to individuals who are sick, struggling with end-of-life decisions, can provide them with emotional support during a difficult time. It helps them feel understood, valued, and less alone in their journey. Everyone deserves to be treated with respect, regardless of the circumstances. Being kind to someone contemplating suicide shows that their value is worth more than a human being acknowledging their autonomy and making such a profound decision. This support can make a significant difference in their well-being and decision-making process. In essence, being kind to people who are sick and considering assisted suicide is about acknowledging their humanity, providing comfort and support, and fostering a sense of connection and understanding during a challenging period in their lives. So today we talked about why people think assisted suicide should be allowed, why it's illegal in some places, and why it's important to be kind to people who are sick. In conclusion, the debate surrounding assisted suicide is complex, with valid arguments both for and against its legalization. Regardless of the legal framework, it's crucial to approach discussions on assisted suicide with empathy, understanding, kindness, and especially when interacting with individuals who are facing terminal issues. By showing compassion and providing support, we can help alleviate suffering, promote dignity, and foster an environment where difficult decisions can be made with respect and consideration for all involved. As we finish, let's remember that it's important to think about what's best for people who are very sick and treat them with kindness and respect. Thank you.